Hi, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Chandler, Arizona. Thank you for tuning into my podcast. This is a quick Q&A. This is one of those moments where we take your questions. We find them online. Generally, I find them on Instagram. I try and look at YouTube. Every once in a while, I get some there. Those are the two areas where I search for them. And sometimes you guys' questions are really important, and I want to make sure I do a video on them specifically because I think it would help a lot more people than just in that one moment where I answer you in the comments section. So this one is another one regarding hormone replacement therapy with women and, women not being prescribed. And it goes, I've asked many times for testosterone or progesterone to go with the estradiol I'm prescribed. They only tell me no every time because it's off-label and they don't know how to use it. Is it possible to work around this and still use my insurance? It's not right to prescribe you estrogen standalone. Some doctors will tell you that when you don't have a uterus, you don't need progesterone. That's not good. That's not correct. And it's very disrespectful to you as a woman. And I've done tons of videos, in the podcast, but let me be very straight here again with it, repeating it, because it does need to be repeated. Again, you're more than the sum of your uterus. Progesterone is more than just protecting the lining of the uterus from becoming too thick. Way more than that. Estrogen promotes the growth of the tissue in your body that's associated with reproduction. So the lining of the uterus, breast tissue, ovarian tissue, adipose, and good stuff, bone, estrogen is not bad, but it needs to be balanced, needs harmony with it. So as estrogen levels are up, you need to balance it with progesterone because, again, breast tissue. Women who have breast pain with every cycle, it's because they don't have enough progesterone. Progesterone deficiency causes that. That's not your uterus. That's your breast tissue. So if your doctor is giving you estrogen and he says, well, you had a hysterectomy, you don't need progesterone, what is he thinking about with your breasts? Is he thinking about your breasts at all? How about this one? Women who have PMS symptoms, mood dysregulation, anxiety, depression, insomnia. There's a reason why it happens at the second half of your cycle. And a large cause of that, not the 100%, but a large cause of that is a lack of progesterone. And we've known this for almost 100 years. 80. So no, 1941. Yeah, so no, not 100 years yet. We're closing in on 100 years on knowing this. So when your doctor says you don't need progesterone because you don't have a uterus, he's not thinking about your brain. He's not thinking about your brain. He's not thinking about your emotional wellness. He's not thinking about you. That's important. That's that alone. We are not supposed to prescribe estrogen without progesterone. And true, in the literature, it's always saying, well, it has to do more with the uterine sparing. But let's be honest. Like I said, you're more than the sum of just your uterus. It is not off-label to prescribe progesterone with estrogen. Even if it is, we use off-label medications all the time. If a child presents to clinic with neonatal Barter's syndrome, which is a potassium-wasting nephropathy, where you lose potassium easily, we prescribe them indomethacin. Indomethacin is a NSAID or a pan reliever. It's an anti-inflammatory, and it's an anti-inflammatory that we use in gout. That's the on-label use for it for gout. It is an off-label prescription to use it with children with a potassium-wasting nephropathy, which is what Barter's syndrome is. It's off-label. The nephrologist still prescribes it because even though it's off-label, that's what's indicated in the literature. That's the standard of care. That's what you use. This whole off-label thing is a cop-out on the part of the physician. It's a cop-out. It's just an epic fail on their part. Does insurance cover progesterone in those cases? It would if the doctor wrote the letter, more often than not. with that said, insurance is getting increasingly horrible. It's not going to get better anytime soon. Progesterone can be expensive. I know that. It depends on how you get it and where you get it. My experience is women, when we prescribe it, they're looking anywhere, when we do it compounded, $20 to $60 a month. It's no more than $100 a month, but 20 to 60 seems the range as I recall. You need it. I actually prescribe that more than I prescribe estrogen in my career, period. I just think about the benefit it has to your brain chemistry. So we use way more progesterone than I use estrogen in my practice. The second part of your question is regarding testosterone. And yes, that is off-label, and yes, it is controversial, and yeah, it's a problem because you need it as much as I need estrogen. Men need estrogen. We're supposed to have it. You're supposed to have testosterone. I understand your doctor having their own boundaries for what they can prescribe. And I'll say this, they should never prescribe estrogen without progesterone. They are not supposed to put a boundary between estrogen and progesterone saying, well, I won't go that far. I'll just do the estrogen. I won't go beyond this boundary and prescribe progesterone. That is just, again, an epic fail on their part in the practice of medicine. That is a failure on their part. And I'm not watering this down, and I'm standing by that. I know that sounds mean to say that, but it's true. Testosterone, I can respect and regard that they don't want to prescribe it because they're not comfortable, because they don't have experience with it. All right, that's good. Because you don't want them to cowboy up into your body and just do what they want to do, right? You want them to know what they're doing. If they give you too much, well, you're not a man. We need to do it right. If they give it to you the wrong way, like a topical, they're going to make you have more dihydrotestosterone. You're going to have way more side effects. You want them running the labs to know what on earth they're doing with you, because when done right, it's amazing, but it's so precise. You need good lab work, you need good care, and you need a doctor who knows what they're doing with it. So I get that boundary. That's valid. And by the way, when it comes to this labbing and care, every 6 months. Once you're established, labs every 6 months. And it's not a big lab. It's just estrogen, progesterone, testosterone. You want to run their CBC in there, make sure the red blood cells are within normal. This is some basic stuff you're doing in there. It's not too bad. And every 6 months, they should be running that lab and looking at it for you. If you've been doing it for a few years, your doctor can move it down to once every year. Sometimes they'll do that. But again, we prefer getting it every 6 months. I guess my final statement here would be, one, don't take estrogen without progesterone. I just please, I'm just imploring you, do not do that. Please do not do that. My second thing would be to try and find a physician that will do both for you. And it's better to have your doctor do all of them. One doctor doing all of those hormones. I hope that helps. Your comments mean a lot to me, and it gives me an opportunity to be more helpful and to have better communication with you and to give you a better understanding of what's happening in times when I know that there's not a lot of good resources out there. So please, if you want, make a comment. Please know that I will do my best to keep up with them, and I will make sure that when they're big ones that are important, such as this one, we will make it a point to do a specific video on them. Thanks again for tuning in. I'll see you soon.